everyone. Today we will discuss on the topic types of adverse event. So firstly we know about what is adverse event. Adverse event it is any untoward medical occurrence that may be present during treatment with pharmaceutical products but which does not necessarily have a casual relationship with this treatment. Adverse event refer to any undesirable experience associated with the use of medical products such as a vaccine, drug, medical device. This event can range from mild symptom to severe life-threatening conditions, and they are critical for assessing the safety of medical interventions. The identification, classification, and management of adverse event are a vital component of the clinical pharmacovigilance and medical safety protocol. Adverse events are typically categorized based on the severity, nature, and degree of association with the treatment. The first types of adverse event is A, type A, augmented. Augmented type adverse event. In this type A adverse event are dose dependent and predictable, typically linked to the pharmacological effect of the drugs, and these events are often the result of the exaggerated therapeutic effect or the intrinsic property of the drug. Type A events are the most common and not life-threatening. They can often be managed by the dose adjustment, continuation, or a switch to an alternative therapies. The characteristics are predictable, dose-dependent, and mild to moderate severity. For example, gastrointestinal upset caused by a non-steroidal anti-inflammatory drug like ibuprofen, sedation due to antihistamine or benzodiazepines. In type 2 is a bizarre adverse event. In this type 2 adverse event are idiosyncratic reaction. It means they are not related to the drug's pharmacological properties. These events are often unpredictable and occur due to individual genetic, immuno or other unique factors. Type 2 events are rare and can be severe or life-threatening. They often require more aggressive management and may lead to the discontinuation of the drug. The characteristics are unpredictable, non-dose dependent, severe. The example of type 2 adverse events such as anaphylaxis to the penicillin or other antibiotics, hemolytic anemia triggered by certain drug like primaquine or sulfonamide in susceptible individuals. Type C, it is a chronic adverse event. In this type that occur after long-term use of drug. This effect might not be observed during short-term clinical trials and become evidently only after prolonged exposures. Type C events are generally cumulative in nature and occur after a month or year of continuous treatment. Their characteristics are time-dependent, cumulative, and typically involve chronic conditions such as organ toxicity. Example of type C adverse events such as renal toxicity associated with the long-term non-steroidal anti-inflammatory drugs are used. Liver damage with prolonged use of drugs like methotrexate or isoniazid. Then type D. Type D are adverse event. In this adverse event are characterized by delay onset. They appear month or year after the use of drugs. This event can be difficult to identify early and their connection to the drug may not be obvious until the significant time has passed. The characteristics are delay onset and may involve serious long-term conditions, implications. For example, cardiomyopathy resulting from the long-term use of the anthracycline, and cataracts or glaucoma caused by prolonged use of corticosteroids. Then type E, it is an end of use adverse event. In this type, it occurs when the is discontinued or used incorrectly. These events are typically associated with the withdrawal symptoms and are common with the drug that cause physical dependence or have a significant effect on the central nervous system. Their characteristics are withdrawal related or can lead to serious complications if the drug is discontinued. The example of type E adverse events such as benzodiazepines withdrawal, Symptoms can include anxiety, insomnia after discontinuation of benzodiazepines, in antidepressant withdrawal symptoms. In type F, it means failure adverse event. In this adverse event, which is related to the treatment failure, this event occur when the drug does not produce the expected therapeutic effect, often due to issues such as drug resistance or suboptimal dosing. Type F adverse events are important to identify as they indicate that the drugs may not be effective or the patient and necessitating a change in treatment. Their characteristics of type F adverse events are treatment failure or often related to the drug resistance or incorrect dosing. Example of type F adverse events are antibiotic resistance, infection that do not respond to antibiotics due to bacterial mutation. Then other classification of adverse events we see. Adverse event can also be categorized in pharmacovigilance by the severity, frequency and causality. Firstly, we see according to the types of severity. First is the in severity. First, it is a mild. The event has minimal impact and on the patient and does not require intervention. Then moderate. This event require treatment but does not the significant harm. Severe in this event is life-threatening and require hospitalization. The another type which is according to the frequency, it is a common. This occur in the significant portion of the population. Second is the uncommon type, which occur in a small subset of patients. Third is the rare. In this occur in a very small number of patients. Then according to the causality, adverse event are it is a definite. The adverse event is clearly caused by the drug. Then second is the probable. There is a reasonable likelihood that the drug caused the event. Third is the possible. There is some possibility that the drug caused the event, but other factor may also be involved. And fourth one is the unlikely. The drug is unlikely to have caused the adverse event. So that's all about the types of adverse event. Thank you.